Hare Krishna. Today I'll be talking about heart healthy diet. We at Bhaktivedanta Hospital, the diet department, we believe that achieving the health is it's an ongoing journey. It's not the destination. So together, let's start this journey and understand what are the facts about the diet. So actually, food is something what we daily eat. Like the day starts with breakfast and it ends with bedtime milk or maybe dinner. So food is a integral part, right? Since we are born. So what do we mean by it's a diet? Basically, food is diet. So what do you mean by healthy diet, and that also heart healthy diet? So healthy diet is something, the food which enters into the body gets absorbed, it gets digested perfectly, gets absorbed perfectly as per the requirement, and the nutrients which are released from the food are assimilated properly in the body, so that if at all we are planning for calcium rich diet, iron rich diet, fiber rich diet, the each macro as well as micronutrient is available to each and every cells, which are the living entities, living units in our body. And if the cells are well nourished, they remain healthy. If cells remain healthy, the organs are healthy. And if the organs are healthy, we say that my heart is good, my brain is good, my liver is good, my kidneys are fine. So let's understand this concept about the healthy diet and specifically the heart healthy diet. We can start with the presentation. So first slide, please. Okay. So what is expected basically? So whenever we go to a cardiologist or to a physician, certain facts are taken into consideration whenever it is concerned with the heart diet. So first is weight loss. The BMI has to be low, okay, low or normal. So that is around 23, 24, so that the blood pressure gets under control, because blood pressure and uncontrolled blood pressure and uncontrolled diabetes are something which actually aggravate the heart condition. So for both the conditions, weight loss is important. Then secondly, we advocate a DASH, that is dietary approach to stop hypertension. Now, what do you mean by stop hypertension? Sometimes, I have met the patients who say that, okay, my blood pressure is 140, 100, and that's a routine blood pressure. Why? Our tiny heart is pumping day in and out to pumping the blood so that the proper functioning of the entire body happens. And if at all it has to pump the large volume of blood every now and then, you can imagine how much degeneration we are actually accelerating. So that is why we have to have the dietary approach to stop hypertension. And how do we stop the hypertension? It is basically having the more of plant-based food, that is fruits and vegetables and whole grains and millets. What we talk about, minimum or no dairy or dairy products, and reduced intake of the controlled intake of the polyunsaturated fats, monounsaturated fats. I will not go too much in detail about the scientific facts, but we'll discuss how practically we can incorporate those stuff in the diet. The next is the sodium content, that is what the salt what we eat, that is what we call as sodium chloride. So normally the food what we eat with the normal salt, it gives around 15 to 17 grams of salt per day, little bit plus minus here and there. Our body needs around 6 to 7 grams of salt when we are non-hypertensive. So imagine when the person is already hypertensive or with the uncontrolled blood pressure. In that case, we advocate from salt-free diet to max 4 gram of salt per day. So what do we mean by 4 gram of salt? It is a teaspoon what is available. So labeled teaspoon, 1 teaspoon is something what is expected to be consumed per day, depending on the blood pressure. And so there are certain other micronutrients which are involved. We can go to the next slide, please. So exactly, let's understand the concept of this heart healthy diet. Now, we all have heard about rehabilitation, like we get the fracture or somebody, suffering with certain things, say, for example, paralysis. So in that case, we have, apart from the medications, we have something called as rehabilitation. So whatever is mismatched, whatever is not in tune with the health, then it has to be done perfectly. That is with the help of the physiotherapy, with the help of many other medical treatments which are available. But today we'll be talking about prehabilitation. So today I do not have any heart disease. I'm not diagnosed with having any heart condition, but I'm supposed to have the self-help for the health promotion, so that my heart is well controlled, well managed with my healthy lifestyle approach. So that this is a prehabilitation which I'm doing, so that tomorrow when I cross 40s, 50s, 60s, it should not be the general statement, okay, your age is this, your blood pressure is uncontrolled, and that is why you've got this problem. It should not become the general statement. And that is why taking the first step towards this prehabilitation is extremely important. So what is prehabilitation? Is taking the action when we are in the good health, which is absolutely in our hands. And it is basically when we take the vaccinations, we take, why do we take the vaccination? So that we don't land up with that particular disease. So these are the preventive endeavors, actually, what we are doing at Bhaktivedanta Hospital. So they are like the vaccinations, so that tomorrow I can protect, I can have the 360-degree protection or preventive approach as far as my heart is concerned. Next slide, please. Okay, so let's understand what are the risk factors which are modifiable. Like sometimes people say, okay, I have a genetic history, my parents have the problem, and so sometimes it is genetic part is something which is non-modifiable. We absolutely cannot change that, but we have certain factors which are modifiable apart from diet. So diet is one of the risk factor. If at all it is unhealthy diet, then we are actually approaching towards the bad heart condition. Apart, so diet can lead to, bad diet can lead to dyslipidemia or hyperlipidemia, what we say when the doctor says the cholesterol levels are high, total cholesterol or LDL cholesterol or triglyceride level is high, or the good cholesterol, that is HDL level, is low. In that case, we say it is dyslipidemia or hyperlipidemia. So that is one of the risk factors of taking one step towards the unhealthy heart. So one is that. Second is weight, what I just mentioned, that is obesity. Third is diabetes. Now, if the HbA1c level, that is the average blood sugar level, is less, it's more than 7 constantly, even for a diabetic patient, not only non-diabetic, but even for diabetic patient, then we need to take extra care. And it is the factor which is modifiable. We can very well bring the diabetes under control. Smoking alcohol is one of the part for the general public. I have to mention this. And stress. Now, stress is something which is a part of our life. Somebody who is a homemaker, or somebody who is a professional working 8 hours a day or working 2 hours a day, actually stress is unfortunately the part and parcel of our daily life. So I will not say that stop taking stress, but I always tell my patients that identify which are the stressors which are affecting your blood pressure, weight, or diabetes. So once we identify the stressors, it's a tiny homework, but it works wonderfully. So just list down the stressors, 1, 2, 3, 4, 5 are the stressors or the stress causing factors in my life, and I am the only one who will have the solution for that. For example, suppose if my son does not call up and then he gets late in the evening, that is my stressor. So simple understanding is, he is supposed to inform me that I will be coming late by 2 hours, 3 hours, whatever it may be. So that stress is gone, or so stress will be there, but it is in the manageable condition. Sedentary lifestyle is one of the major risk factor. So when we say sedentary lifestyle, actually we say that we have been traveling and I move around in the house, the entire household chores are taken care by me. So this is still, this still comes under the sedentary lifestyle. See, heavy workers are those like the construction workers, and obviously we are not into that category. So if at all I am not moving around too much, or I may be moving around, but that is not as per the required expectation of the body, then that becomes the major risk factor for the heart condition and obviously the hypertension. So these are all the factors which are risk factors. That means they can cause heart disease, but they are modifiable. They are still under our control. So if we modify them or bring them under control, we can prevent or manage the heart condition very well. Next slide, please. So let's start with the education. Next slide, please. Okay. So basically, as per the Charak Sutra, as per our ancient science, it is said that heart attack is born by the intake of, first is the fatty meals. So if at all there is unnecessary usage of oil or ghee, where oil or ghee is, it may not be actually floating on the top, but it is a major part of the meal, then that is something which causes heart attack. And that is also constantly, like regular, this is what we eat. If at all there is overeating, I'm full. Actually, my capacity is of eating say 3 chapatis. I'm full, but I've liked the vegetable, or somebody insists that you can have the 4 chapati, and I tend to overeat, or I eat not by the hunger but by the sight. I'm not hungry, but somebody is eating, and then some food is offered to me, and I start eating that. So it is overeating. If at all I am sleeping excessively, that rarely happens, in fact, nowadays, but there is a category of a group of people who sleep excessively, or sleep in the wrong time, like night sleep is not there, but during daytime the person is sleeping, or there's a sleep deprivation. Okay, there are many people nowadays. Just today morning I met the patient. He said it is just 2 to 3 hours sleep in a day, because first of all I don't get the sleep, and if I sleep, it is the time to get up and get ready and go for the office. So deprivation of sleep is something which is extremely bad. Apart from that, anxiety, any type of anxiety, stress, what we just mentioned, sedentary lifestyle, that is lack of exercises, under the name of no time for exercises, or I'm not used to, or I'm not the exercise person. So whatever it may be, this is all the result of the urbanization, which is taking us towards the unhealthy heart condition. And so let's understand how we can control that. Next slide, please. So, do I need to know all those things? If at all any of the symptoms are present, it is something which is giving us a signal that I should start worrying and start taking care of my heart. If at all I am feeling tired, in spite of I eat adequately, I have no stamina. When I get up in the morning, I feel like sleeping another 5 to 10 minutes more, or in the late evening when I'm back from the hospital or office, and then I'm exhausted completely. I get irritated very fast. I know that I should not get irritated, but I do get irritated very fast. If at all I have persistent body ache or leg pain, or it is a vague pain maybe, or if at all regular digestion issues are there. Nowadays, having acidity or acid regurgitation, or having bloated abdomen, or having constipation, or passing the motions after each meal, all those things are actually, these are considered as the common digestion problems. And nowadays people are aware exactly over the counter drugs are available, and then you drink that or eat that and my acidity is gone. But if these are the concerns which are there, please understand the body is trying to give you a signal. It is trying to give a signal to all of us to understand that there's something which is not right, something which is not in fine tune with the health, and we have to take care of it. So next, and we have to go to the root cause and understand where the things are going wrong. Next slide, please. It's a very nice, it's I call it as necklace analogy. So necklace is basically pearls which are together joined, so that way we have the digestion tract. It's a very amazing fact which you may be aware, but I would like to stress upon this, that there's a digestion tract which is almost 25 feet long. It's like a tube, and it's coiled. So you may be 5 feet or you may be 6 feet. It's coiled, that intestine is completely coiled in the abdominal area. and you imagine the food what we ingest, we may or may not chew, it may or may not get digested, and that undigested or partially digested food, it moves around the intestine. There the good bacteria or bad bacteria, if at all there is imbalance over there, then it may create more gas formation, more acid formation, or the food may not be completely absorbed. If it is not absorbed, the nutrients are not available. Nutrients are not available in the bloodstream. Even if we are eating, our liver, heart, kidney, brain, they are starving. So if at all, this is, it's a necklace analogy. So if one pearl is missing, if one bead is missing, then the entire necklace is broken actually. So if at all any single link is missing anywhere, then actually we are not completing that process, a process of digestion, which is actually the main system where the entire body is dependent on. If I say I'm supposed to be taking magnesium supplement, just popping in magnesium tablet is absolutely fine. But is that magnesium getting processed and absorbed by the system or by the organs wherever it is needed? It's a big question mark. So we need to understand this very well so that we can decide exactly what, when, how much, and how I am supposed to eat. Next slide, please. Next slide, please. So when we say atherosclerosis, so atherosclerosis, you might have heard about this word, where you can see on the top left-hand side, this is a normal artery. Artery is basically, it's like a tube. So you can see it's very clean and perfectly shaped tube through which the blood flows. And if at all, with the wrong meal selection or the wrong portion size selection, or other factors, whatever we just discussed, the plaque formation happens. And if at all this plaque formation gets progressed, so you can see once the plaque is formed, the blood flow gets limited, and slowly, steadily, if at all there is a clot formation, if there is a rupture and there is a clot formation, in that case, the artery which is supplying the blood to that particular organ, the organ does not get the adequate blood supply, and then we land up with the problem. So here we can talk about the heart, where if at all the heart is not getting proper blood supply, and then we start getting the symptoms, and where the doctor diagnoses that you are having ischemic heart disease, or whatever it may be, or a complete heart block, or whatever it may be. So this is basically what happens when the proper blood circulation does not happen to that particular organ. Next slide, please. So what is our responsibility? If those things are happening, then what is our responsibility? Next slide, please. Okay, so it is diet's simple 5. So simple 5 is basically managing the blood pressure. We say 120/80, it may differ depending on the age and other factors, but this is something by and large we look for. Then managing the cholesterol. And when we say managing cholesterol, it is not only total cholesterol, but bad cholesterol and triglycerides, along with the good level of good cholesterol is something which is extremely important. Managing the body mass index, that is managing the weight in proportion to the height, is important. And here, apart from losing weight, I normally specify losing the fat content. So Indian structure, basically the belly fat is something which is the waist circumference is something which has to be in proportion with the chest and the hips. So if that proportion is managed, then definitely we are reducing the risk factor with good food and right eating, with the managed blood sugar. So basically pressure, sugar, weight, and cholesterol can be managed with eating better. And this is the simple understanding as far as the prevention of the heart condition is concerned. Next slide, please. So when we say eat better, what do we mean by? So it is just aaj se thoda kam. If at all I'm having diabetes, then sugar should not be the part of my diet. Now people say if no sugar, then I can eat jaggery, honey. See, any simple carbohydrate, whether it is sugar or jaggery or honey, nutritionally something may be better than another food, but overall they are simple carbohydrates which actually do not give the right insulin response. So if at all I have to manage weight, or if at all I have to manage my diabetes, the sugar should be completely no. So people say that if sugar is out of the diet, then I feel weak or giddy and the sugar drops down. Actually, no, it's all psychological, but it doesn't mean that sugar is stopped means I'm not getting sugar in my diet. We still get natural sugar in the form of the fruits, in the form of certain dry fruits like figs and raisins and apricots. So these, and also obviously the carbohydrates are available from the Indian staple food, which is a cereal, which is the main part of our Indian diet. So don't worry, even though the direct sugar is out, which also helps to control the triglyceride level, we are not at all at the risk. In fact, the heart will be thanking us. Then second is salt, what I just discussed, that we have to have either salt-free diet if at all the pressure is extremely uncontrolled and very much fluctuating. And once it is under control, it can be 2 grams to 4 grams to 6 grams, 5 grams also, but it depends on what your doctor prescribes. So please make sure that suddenly overnight the salt is stopped is not advisable, because each individual is different. So please take the medical advice before making any drastic changes in the diet. Salt also, another thing, we have regular salt. Sorry, first slide only, previous slide please. So another thing is salt can be the regular salt, that is white salt, what we say, and it can be the black salt or the senda namak, what we say. So there can be 50% usage. We are supposed to use the regular salt also because it is iodized and iodine is required by the body. Here I can specify, if there is no heart problem or kidney problem as such, we can replace sodium chloride by potassium chloride. That is what we say, the low sodium salt what is available in the market. But if any heart concern is there or any kidney concern is there where potassium also has to be controlled, in that case kindly take the advice from your concerned health care person. Bad fats is basically anything which is solid at room temperature is bad. All bakery foods, we say brown bread, white bread, multigrain bread, whatever it may be, any bakery food cannot be, the process cannot be completed without using any hydrogenated fats. So make sure the bad fats are out of the diet. We will talk about the fats, which oil to include, that I will talk little later. Complex carbohydrates is something, is what are cereals, rice. If at all rice, it should be unpolished rice whenever practical possible. It is wheat, it should be unsieved wheat flour. If at all we can have millets, then jowar, bajra, ragi, these are the neutral millets. If at all I still want to go further and I want to add millets which are nowadays available, it's a millet year declared by Modi ji. So it can be barnyard or foxtail or kodo. There are different types of varieties are available. So these are the complex carbohydrates. They should be the part of the diet, but definitely in controlled portion. For the antioxidant or for the anti-inflammatory effect, the colorful fruits is something which is extremely important. We can add a variety, but make sure that fruits are consumed in the whole form and not in the juice form. Pomegranate plays extremely important role as far as the heart health is concerned. So make sure that pomegranate is a part of the daily diet in the form of the whole seeds. Good fats. Now fats are not bad. Like ye nahi, wo nahi, everything cannot be stopped, but we can use the invisible good fats. They are present in the nuts, that is almonds, walnuts, or the oil seeds, that is flax seed, sunflower seed, pumpkin seed. So something, when the direct sugar is out, the natural sugar is in. The bad fats are out, the essential fats are in. The refined carbohydrates are out and the complex carbohydrates are in. So we just have to understand what is it which is causing problem in my for my condition, what I need to replace by what. So if at all this simple shift is done, then definitely the shift from the disease condition to the healthy condition also happens. Next slide, please. So basically we expect that, as I mentioned, anything which is hydrogenated has to be out, but we can use the oils which are specific to that particular region. For example, in Maharashtra, if groundnut oil is consumed, absolutely no problem. Whenever feasible, practical, possible, we have to make sure that we go for the cold pressed oil or the kachi ghani ka oil, what we say. In north side, if the mustard seed oil is used, that's absolutely okay. Rice bran oil is another oil which is rich in MUFA, that is monounsaturated fatty acids. So this is something what we can prefer. Two things what I would like to specify. One is, whenever possible, we should go ahead with the cold pressed oils. We have to make sure that even though oil we are using, this is a visible fat, should be used in control. That is something which is important. And obviously something which is fried, when the oil is exposed to the high temperature, that oil should not be reused, because then that causes that accelerates the hardening of the arteries. So this is about the oil. People say that it's a myth actually, that I have cholesterol, so I've stopped coconut, I've stopped groundnut. See, seeds, what we say, flax seeds. So basically these nuts and oil seeds, they, if at all they are consumed in the right proportion, along with the essential fat, they add good fiber also. So I'm using less oil. Say for example, I'm using groundnut oil. I'm using less quantity just for the dry jeera to dip in. And I can definitely use, if at all groundnut is something, crushed groundnut is a part of my regional cooking, I can use in little moderation. Again, it varies from person to person, but this is just for your understanding. Next slide, please. So good fats is basically walnuts, almonds, seeds. Now rajma is something, now you may say, what is rajma? So rajma is basically good in omega-3 fatty acid. So rajma nobody can eat on a regular basis, but if at all it can be the part of our salads on and off, that is beneficial. Bajra is something, millet, so we can make bajra in the whole form as khichdi, or we can make flour and we can have a roti form. Basically, this is omega-3 is needed to increase the good cholesterol level. Next slide, please. So these are the micronutrients which are required. So if you see, we need not go into detail. Okay, vitamin C is rich in what? So vitamin A, C, E, selenium, zinc, these are the micronutrients or the trace elements which work as an anti-inflammatory effect. They have the anti-inflammatory effect. So whenever feasible, practical, possible, including the variety of the vegetables and fruits, what we mentioned, the colorful vegetables and fruits, nuts and oil seeds. Now till, for example, now till is consumed normally whenever till in the form of til laddu or chikki, whenever the occasion or festival is there. But why can't til be the part of a regular masala dabba, where I'm using rai jeera, and along with that I'm using til on a regular basis, not necessarily in seasoning. I can put little till 1 to 2 tablespoon till while rolling out the chapatis. So whenever, whatever feasible, practical, possible, we can incorporate those functional foods so that the micronutrient intake is taken care of, requirement is taken care of. Next slide, please. So I will not go into detail, but what we have to understand is we have to have the good portion of the cereals in the form of the millets or the whole cereals. We have to have good portion of, in proportion with the cereals, we are supposed to have good portion of vegetables and fruits. And I always advise it is 5 a day. What is 5 a day? It is at least 2 servings of fruits and 3 servings of vegetables. Is something should be the part of our diet, along with other things. Now somebody may ask, what is cocoa and chocolate? Can it be the part of the diet? So dark chocolate actually has an anti-inflammatory effect, but it doesn't mean that I don't eat chocolate and suddenly I start eating chocolate. So this is for the people who need chocolate. A small tiny cube of dark chocolate eaten mindfully, just a tiny particle of it, but has wonderful effect. Next slide, please. So when we say salt, it doesn't mean only white salt. It is the Chinese salt also, what we say Ajinomoto. The bakery products have very high amount of salt. So even if we don't put any salt on the top, but still eating 1 or 2 slices of bread, my salt quota for the day is over. Edible soda, what we use for making we use for making doklas and idlis sometimes. So that is something has a very high level of salt. Soft drinks, soft drinks, people say they are sweet. So how come salt is there? The sodium benzoate is a part of the soft drink. So that is also one of the culprit for not allowing you to control the blood pressure. Salt preserved foods like pickles and puppets, salted foods like chips and other ready to eat snacks available, preserved foods like jams and sauces, ready to use mixes, just mix water and eat it. So everything, all those things, products what I mentioned, they have the hidden salt. So if I'm restricting the salt, but still my pressure is not coming under control, there's some hidden salt going in my diet. So we have to analyze and understand and remove that from our diet. Next slide, please. So when we say high fiber, is basically high fiber is needed for managing the cholesterol level. So all the seasonal fruits available, provided we eat them with the skin whenever possible, practical. No making juice, but we are supposed to eat them whole. Apart from that, we have certain millets which can be the part of here. I have not mentioned millets, but actually millets are very high. They have very high level of fiber. So only understanding is whenever we are using millets, they have to be soaked thoroughly, like at least for 8 to 10 hours they should be soaked, and then we should do slow cooking. So the amount of fiber available, actually all kinds of digestion issues are taken care of. So instead of taking pulses, we can have them in the form of sprouts. So these are the certain steps what we can take to make sure that my body needs around 25 to 30 grams of fiber. We do not consume more than 10 to 12 grams of fiber if at all we are not conscious. So consciously, if at all we include those foods in our diet, we can add those extra 10 to 15 grams as per the need of the body. Next slide, please. So cooking creatively, somebody who is cooking prasadam, creativity is already there. So I need not mention about this, but wherever practical possible, we have to make sure that we use the cooking methods where the smart cooking methods where the oil content is limited. Next slide. I need not mention this here. So we have to be dependent on plant-based foods. Next slide. So that's it. And maybe if at all anybody having questions or any doubts or want to clarify some myths related to millets or intermittent fasting, there are certain eating patterns which are there, and if somebody is following, I start following them blindly. So what should I do? Whether I should be eating every 2 hourly or I should be eating only twice a day? Is boiled food advisable? Salt dilemma. If these are just the examples what I mentioned. If you have any questions, you can go ahead. So Proji, can we take the questions? Can we have the questions, or I don't know if Hare Krishna.
So we have a question. What is the best time to eat millets?
Okay. See, millets can be the part of breakfast, lunch, as well as dinner. There's absolutely no problem. Now, there are two concerns. One is millets have to be soaked, as I mentioned, and they have to be cooked on a slow flame. Like we cannot pressure cook them. Then the acceptance becomes good. Now, there are some people who cannot digest the high fiber content which is present in the millet. So in that case, we cannot overnight replace the wheat and rice by millets. So the inclusion should be at this slow, like only one meal should be replaced, and that also during the day, basically during the day, in the sense either breakfast or lunch. Then the and once the body starts accepting, then we can switch to dinner also.
The other question we have, what types of food should I eat or avoid to help prevent or manage cardiovascular disease?
So this is the gist of the presentation, is basically eating the natural food in the sense food which is near to nature. That means it is minimally processed is something what we are supposed to eat. So whenever possible, raw fruits and vegetables, whenever possible, minimum cooking, whenever possible, slow cooking is something what we are supposed to have. Something which is preserved, like something which is stored in the refrigerator and then used over a period of 2 to 3 days, not advisable. So freshly cooked, home cooked food which is near to nature is something what we are supposed to eat. Then this is the first thing. Secondly, eating 1/4 less than the appetite, so that we have little space left, which aids in the digestion. That is extremely important. So even though we are eating good food but not processed properly, may land up with the problem. Eating slowly is something which is very important. Like we are supposed to spend at least 15 to 20 minutes in meal while eating meal, so that adequate chewing which help the food gets mixed with saliva, which is the first step of the digestion, so which is extremely important. And we should not be eating when we are under stressful condition or when we are in anxiety. So better we can skip the meal, but not to eat when we are in with any negative emotion. That is something what we have to keep in mind. And inclusion of 5 food groups, that is the cereals what I mentioned. So whether it is wheat, then unsieved, it is rice, it is unpolished, or the millets. Second food group is dals and pulses. So all dals and pulses, whichever are the part of our regional routine, can be very well consumed. Third is the fruits and vegetables. Fourth is the dairy. Now, if at all I am having lactose intolerance, then definitely dairy is not the part of my diet. But if at all I'm used to, I have some psychological bonding with milk, and I do have A2 cow milk available in my vicinity, I can very well go ahead with that. So either in the form of milk or in the form of buttermilk, that's absolutely fine. If at all paneer has to be made, it has to be made at home. And if at all paneer is the part of the meal, again, please understand the vegetables cannot be replaced by paneer. So paneer can replace lentils because it's a protein stuff, but we have to make sure that the green vegetables are a mandatory part of the diet. And apart from all those 4 things, what essential fats and good carbohydrates, what I mentioned, like nuts and oil seeds. So if those 5 food groups are adequately included in the diet and consumed in this form, then definitely it is helping us to take the step towards the healthy heart. And anything which is processed, ready to eat, open the packet and eat, is something which is taking us away from the healthy heart.
Other question is, how can I create a dietary approach that fits my life and culture?
Okay, it's a wonderful question actually. I'll tell you just one example, that today morning I got a call from the department, health checkup department, saying that patient is saying that my cholesterol is high, sugar is high, pressure is high, and if at all, if I go to the dietitian, she will say not to eat this, not to eat that, and which is not practical for me. So it is difficult, and then something like that. So I told her, just send him to me. and I'll see what has to be done. Now, when the patient comes to me, obviously somebody who is having the marketing job, somebody who is moving around, for somebody the home cooked food is not feasible and available, somebody who is extremely busy or tied up with the professional schedule. So in that case, considering my scenario, definitely leave the job and sit at home and just concentrate on the meal is not the practical solution. So what I advise, that understand what is the factor which I need to modify. For example, he was not sleeping adequately, so he would get only 3 to 4 hours sleep. So he would sleep only at 2 o'clock and 3 o'clock in the midnight. So if at all, and I asked him whether 11 o'clock is possible. So take it, thoda early sleeping, and then he may get up by 2 o'clock, 3 o'clock. That's absolutely fine. So taking one baby step at a time. I'm not able to sleep for 6 hours or 7 hours, which is needed, but at least I can start sleeping on the right time. It is the first step. Secondly, then I increase the duration as per the requirement. I do certain techniques. I can learn certain techniques which will help to have the healthy sleep. So these are, or maybe the medical support. So identify what is the problem, where I need to change, identify how I can rectify that problem, and the implementation is absolutely fine. So basically, we just have to have the biological clock which is set. We are used to one particular pattern, and then shifting becomes little problematic. So I would not say problematic, it's challenging. That's fine. So if entire family the entire family sits together, this works wonderfully actually. Yeah? They discuss what can be the healthy diet meal options. Like every Sunday, I give this exercise to my patients. Some entire family should sit together, plan out. Okay, Monday breakfast is this red poha, for example. Tuesday is dalia, then Wednesday is some millet khichdi, and Thursday can be multigrain dosa. So if this type of menu is planned, considering the like family members' preferences, then making sure that whatever I've planned, the pantry, my kitchen is upgraded. Like I need millet dosa, so that means the millet should be available at my place. So on the day when it is possible, the entire family can get involved in developing the healthy menu options, making sure that the kitchen is ready. So it is just cooking and serving. So nobody will say, "Arey, why poha today?" But it is mandatory. It is decided that Monday will be poha. So that way, this is one example what I gave. There may be some different solution for your family, but if at all together as a family, if we decide one particular eating pattern, one particular lifestyle pattern, it definitely helps. See, if at all the problem is there, the problem always comes with the solution. It cannot be only problem is there and I don't have the solution. I am not the morning person. That's absolutely fine. I cannot get up early in the morning. So I'm not saying that you get lit up, get up late. So that anyway we have to improvise. But take it, what I can do today. So I can start going for a walk in the evening or in the night, whatever is okay with me. So this way, if at all we have the practical approach, believe me, within a 1 month's period, you can feel the transformation. Within 2 months of period, you will see, if at all this combined approach is there, you will for sure see the changes in the blood pressure and the sugar readings. So that's absolutely possible if work together.
Other question we have, does one food fits for all or we customize?
Definitely no. One food doesn't, like suppose if I advise intermittent fasting, it may not be advisable for all the people. Somebody who feels hungry at the particular intervals, then I have to have few small frequent meals planned for him. So there is no one diet fits all. The diet pattern, there is a eating pattern as well as food content. Milk does not suit me. That doesn't mean that there is a problem with the milk. There is a problem in my system. It cannot process the milk because I have the lactose intolerance. So it is not that milk is strictly no, or nay, you have to have calcium and protein. So you drink milk, even though lactose intolerance is there. It does not happen that way. So please understand how our body gives wonderful signals. So please understand, have the patient listening to your body, and if at all we give that little time just to understand exactly where I'm heading to, what I can manage, what I cannot manage, the things which I cannot manage, what is the alternative. If this way, if at all we work, then it can be a customized approach. Only one thing is that if at all there's a joint family or many family members, it becomes little challenging. Like we cannot say ki everybody start eating pumpkin vegetable and stop beans. It does not become practical. In that case, little extra effort will have to be taken. But otherwise, by and large, per family we can have one approach. But as far as the meal pattern and the food content and the portion size concerned, it differs from person to person. That is extremely important.
Next question we have, in ISKCON, we eat 2 times. Generally, is it okay? Especially brahmacharis, like around 10 a.m. and before sunset.
That's actually perfect schedule. Like normally I advise people that we should go ahead with this, because one very wonderful, the God has created such a wonderful system that we have a healing capacity. Our body can heal on its own. So by any chance any toxins are getting accumulated, by any chance there's any type of disturbance, if at all we are giving time to the body to heal on its own, that's wonderful. And from that point of view, having early lunch or brunch, whatever you may call, and having early dinner is extremely beneficial. Now some people, some brahmacharis do have concerns about acidity or a little bit more appetite. So if there is a concern like this, then something like I advise to include some fruits and dry fruits, something which is not heavy for digestion, but something which can be included in between those two meals, which is something which is required. Again, by and large, this is a good approach, definitely good approach, but with certain exceptions. Like I had met one brahmachari who had a tendency of going into low sugar levels. So after eating at 5 p.m., he would straight away eat at 10 a.m., which was causing the disturbance for him. So then I had to add some bedtime, a glass of milk or something like that. So the variations will be there, but this is a good system.
Okay, so we don't have, we can't see any more questions. So I would like to thank Vaidehi Nawate ma'am to remove the एक second, क्या बोलता है इसका कहीं? नहीं, we can take these questions. Ma'am, we have one question. Is breakfast must? Last question.
Okay. So I suppose this is the last question, right? See, breakfast should be the start of the day for sure. Now, again, it will vary. Now, when we are talking from the heart point of view, if at all we are taking 2 meals a day, which is needed for the healing purpose, then instead of breakfast, we can include brunch or early lunch, then breakfast is not there. If somebody is starting the day very early, say 6 o'clock, 7 o'clock, has to leave for the office, or it becomes little difficult. In that case, breakfast can be consumed, definitely consumed. That's absolutely no problem. See, it depends on which biological clock is set for me and what is my working system. So if at all I am not able to have my lunch, then brunch is advisable. I can have lunch and I don't have time to have early lunch, then I can have light breakfast to start the day with. So this is something which is extremely important, which we can manipulate and modify as per the circumstances.
Ma'am, the last question we have, heart and sweets, how it should be managed?
Somebody having sweet tooth and I have mentioned no sugar, so it is a little concern. And I can see the smile on Sandeep Prabhuji's face. See, actually, sweets are the rich source of, one is simple carbohydrate and one is fats. Okay, now simple carbohydrate and fat, this combination is slightly dangerous, not slightly, more dangerous from the heart health point of view. So here the concern is, if somebody is not having diabetes, somebody's weight is managed, it is no high BMI as such, and other risk factors are not there. In that case, occasional sweet intake in the right portion size is absolutely no problem, absolutely no problem. But if somebody is having one of the risk factors, and where sweets are consumed like prasad, like we never say no to prasad, and ISKCON, whether it is in the temple or is in the hospital, everywhere we get prasad. For the smallest professional visit also we go, and then we end up the meeting with prasad. So if a consistent intake of sugar is happening, that has actually wrong effect on the triglyceride level, that is the cholesterol level, and uncontrolled diabetes, uncontrolled sugar if somebody is having diabetes. So in that case, sweet is something which is not advisable for the person who is having heart condition. I do advise my patients to have sweets in moderation जब भी celebration रहता है. So if at all it is any anniversary or it is any birthday celebration or festival season, that's absolutely fine. It done in moderation, provided other risk factors are under control.
Okay. Thank you so much, Vaidiki Navati ma'am, for delivering and providing us the wonderful information on how to take care of our heart with terms of dietary aspects. So we have Mr. Sandeep Kamal, Sarvagya Krishna Das, who is heading Branding and Promotions Department, working with Bhaktivedanta Hospital since last 20 years now. So I would like to convey to say a vote of thanks, Sarvagya Krishna Das.
Hare Krishna, thank you very much, Vaidhi Mataji. Just to add, you have been a pillar of support for all the big sannyasis, brahmacharis and grihasthas for the last 25 years since our hospital has started. So your smile says it all, that because of your diet, many of the people, they have become better and brought back the smiles. So thank you very much once again for your wonderful talk. And to all the devotees who are watching this particular session, we'll be uploading this video once again on YouTube channel. We'll be sharing the link. So this is a feature as a part of our ISKCON Devotee Healthcare Services, which we started to commemorate the 25 years of completion of Bhaktivedanta Hospital. So this particular project has been started keeping in mind the health of all the devotees, because as we say that the three aspects of health is swasthya, sadhana and seva. So unless you have a better health, probably the service and other aspects get affected. So if any of the congregation members or any of the brahmacharis or temple leaders want to conduct such sessions in their group, so the numbers are shared, myself, Sarvagya Krishna Das and Sudhir Chaitanya Prabhu. So you can contact us. We'll be sharing this particular information on the description also. So thank you once again, all the devotees who have joined, and thank you once again, Vaidhi Mataji, for your wonderful talk. Hare Krishna.
Hare Krishna.